There's a crisis, y'all. Yes, it's been declared by many dental organizations. Even the organization for dental education has declared that there's a crisis in oral health. But why is there a crisis? Why is there a crisis? What is the crisis about, and why? So, Doc, tell us a little bit more about what's going on and what's being done to address this crisis. And introduce yourself for those that are meeting you for the first time.
Absolutely. Well, first of all, thanks for having me. My name is Patrick Smith. I am a general dentist of about 17 years. My former role is a faculty member at University of Illinois, Chicago College of Dentistry, where I'm also the Director of Diversity, Equity, Inclusion, and Belonging. And so I've been in that role not very long, but throughout my career, even the catalyst for me getting into academia was sort of understanding that there were some challenges that Black men face. I am a board certified public health dentist. So my primary focus was always on what do we have to do to get brothers in the dental office? What do we have to do to expand access to care and get better outcomes? And what you find is that it's a big part of that is understanding who our workforce is. You know, so when a person of color walks into a dental office, who's receiving them? You know, and when you look at the representation of Black men in our profession, it's very grim. And so that's something that's always sat with me, even as I was a dental student. And so now having the opportunity as a faculty member to really ask these questions and think about, well, you know, what are we missing here in terms of getting more Black men involved in the profession? What are we missing in terms of improving the oral health and the access to care for Black men? This is the focus. This is the agenda, so to speak. And these are the kind of things that, you know, we're trying to learn more and more about every day to figure out what we can do.
Yeah, and the learning piece is key, right? Because we don't even know what we don't know. You know, we have an idea, or we may have some ideas based on what we've observed, maybe what we've heard from others, you know, what numbers from other reports that we've seen, but there's usually more to it than what those numbers, like those numbers have a voice as well, or those numbers have a story, right?
Absolutely.
Those numbers have a story. So tell us a little bit more about the origins of this survey that's being conducted.
Right. So this all started maybe about 2 years ago. The American Dental Education Association made a pretty bold statement where they pretty much said that the lack of representation of Black men in the dental profession was a crisis. And that sparked a lot of conversation within the profession about, well, why is that, and what do we need to do to address this issue? And what's the downstream effect if we don't address this issue? So there's been 2 symposiums that have been had within the last couple of years of bringing stakeholders together to engage in these conversations. What I observed in that, and this is not a knock, this was a great start, right? Because those conversations serve as the catalyst for this survey. It really made us think about what are the anecdotal pieces that may be intuitive to us, Dr. Hayes, as dentists, as people who are interested in this issue. You know, these are things that we can have a side conversation about and say, oh yeah, this is what's going on. But when you walk into a dental school, you don't see a whole lot of people who look like us who can even share that anecdotal piece. And so a big part of the piece is also understanding that when the data gets put out about people of color, and there was a huge report also at this time that the American Dental Education Association put out that, you know, it pretty much lumps everybody together under the auspice of historically underrepresented. And so within that, we understand that Black men, there's a cross-section there where Black men could be having a totally different and unique experience, which you've already identified when you said this was a crisis, particularly singling out Black men and the lack of representation. So where's that data? Where's that information? How is that story being told? Is that story being told? And so a big part of really trying to develop this survey instrument was just to get more information that is specific to the experiences that Black men have had while they're thinking about a dental degree, while they're applying to dental school, while they're studying in undergraduate institutions, engaging in different experiences, are there some commonalities? Are there some differences that other cohorts of individuals may experience that we don't experience? And so what do we have to do if we have a better story that we can tell? How do we take that to the next level? So that's where we are. We're at the very beginning phases of this and just trying to figure out, can we gather information? Can we engage brothers? Because that's also a part of the conversation as to why this has never been done, is people don't believe that, one, they don't believe it's enough Black men in the profession to give any meaningful data. Two, they don't believe that Black men are actually going to participate in the research. Three, people don't even know where to find us. We're dispersed and distributed all over the country. And so when you don't have a critical mass that you can easily go to collect data, it creates a bigger challenge in terms of getting meaningful survey data. So this is an attempt to see if we can get brothers aware of what's going on and get brothers to participate, see the importance of it. Because again, like you mentioned in the very beginning, we're trying to address the crisis. So it's almost like a call to action. We need all hands on deck for this one to make sure that we can get our stories out there.
And keyword, all hands on deck. All hands on deck, meaning the more that know about the survey, the more that can participate, the better, because we need mass dissemination and we also need mass participation, so that we can lead with the science, right? Like you mentioned, we talked about before, leading with the science and having the information, because the numbers don't lie, right? There's going to be an interpretation of the numbers, but we need the numbers. The numbers need us. The profession needs us to participate, because this segment of the population of oral health professionals is not belonging right now. It's not necessarily completely integrated or being included, right? Not having their diverse backgrounds and experiences being shared, right? And they may feel that there's not an equal or equitable playing ground as well. But we don't know, because we haven't asked these questions of those individuals, and that's why the survey is so important.
Hey, this is Dr. Darwin. Are you looking for some mentorship, some accountability, some help with getting all of this application and getting into dental school and getting into residency and then just your life as a new dentist? Look, I'm having monthly, twice a month, live coaching sessions and office hours so we can talk about all of that. I don't want you to struggle with the application process. I don't want you to struggle with getting ready for interviews. I don't want you to struggle about what list of schools and programs to apply to. We talk about all of that in our group, our monthly group called Dr. Darwin On Demand. Dr. Darwin On Demand. Check it out down below here. And then also, if you're interested and you want to get that help so you don't have to struggle anymore, so that you can get some mentorship, some accountability, and some help, hit this link right here. Hit that link right there so we can get you signed up and enrolled today. Today. Your future starts today. And I'm here to help you. This is Dr. Darwin. And join my members-only community called Dr. Darwin On Demand. Look forward to seeing you soon, okay? Now back to this episode. Enjoy.
Once the survey is done, and I know you mentioned that, this is the first step, but it's an important step. How do you see the survey being tied to other goals or other things that are on the research team's list of things that they must and want to achieve?
Well, the biggest thing is drawing more awareness. So giving us a baseline measure, something to describe the experience with. This actually came to me, I forgot to mention, as a third-year dental student. who's at UIC College of Dentistry. Her name's Danae Ashford. And Danae, when you think about the generation of dentists that are entering the profession, they have questions. And, us being in a position to try to help them get their questions out about what does this mean for me entering into this profession as it pertains to diversity, that's very important. So, part of this is also listening to the voices of those students who are going to be future dentists, and when you think about that in terms of how do we use this data for the future, I think it's imperative that people pay attention, people in institutions of higher learning, pay attention to the narrative and not settle for whatever narrative gets created within the four walls of any dental school. Because I can tell you, you walk in any dental school in the admissions meetings, people come in with their unconscious bias, they come in with their opinions, they come in with the student who graduated 5 years ago who had an experience versus saying, no, do we have more information? Collectively, are there some things that we need to be looking at, that we need to pay attention to as it pertains to how we recruit Black men into the profession? How do we mentor Black men entering into the profession? But then also, once they're there, right, what kind of resources do Black men need in order to build that resiliency that is necessary to graduate and be successful? So all of that, to me, starts with understanding a little bit more, because when you look at the numbers, Dr. Hayes, we can say that the numbers are low. When people call on me to be the voice for every Black male applicant that comes through the door, you understand what I'm saying? No. I need something more. I need to say, no, not just me, but you have hundreds of Black men who said this is a thing, right? And so now, when you try to challenge me, or when you try to lean in on my own personal experience, we understand that that's limiting, so how do we get past that limitation? And also the people who work in institutions where there is not a person of color, a Black male of color, who can even share that personal anecdote. What are they going off of? So some people have no voice whatsoever helping them guide the conversation and the intervention in order to address this crisis. So that's what I would hope. One, awareness. Two, giving us data points for intervention. And I look at the interventions in those buckets that I mentioned, recruitment, mentorship, and resilience building, in addition to academic support,
Yeah.
So there's a lot more that we could have asked on this survey. So we're hoping to get that kind of feedback as well. I see this as the first iteration of something larger, because, within a survey, you only want to take brothers' attention span for 5-minute intervals, but moving forward, are there some questions that we missed? Are there some questions that we could ask differently?
Yep.
Is there a convening where we perhaps need to meet with brothers to get some qualitative data, and get some richer information about these collective experiences, not the one-off, experiences that I may have had or that you may have had, but collectively, what did we both go through that was similar, that was influential in helping us get to the point where we got into dental school?
Yeah, and I think that's key, man. That's key to have that as a target, and the reasons that you mentioned. And now we got to go to work. We got to go to work. I know of at least 150 dentists, Black male dentists, that will be filling out the survey and will be disseminating out this survey. But that's a small percentage of the smaller population of individuals that we need to reach, right? So that we can hear this story and hear this information and use that moving forward. So call to action, guys and gals and people and interested parties and those that maybe have had these same thoughts and ideas, but maybe have not put the foot down on the pedal to get it to happen. Now's the time. It's happening. Now you can contribute. So, Doc, what's the best way that we can help with the efforts that student Dr. Ashford and yourself are doing with regards to the survey? How do we help? What can we do?
Right. Well, the biggest thing is, if you see the survey, complete the survey. If you're eligible to participate, if you're a Black male dentist, regardless of specialty status, regardless of whether you're still in practice or retired, whatever the case may be. If you graduated from a U.S. dental school and you are an African-American male, complete the survey. The other thing is forward to other Black male dentists that you know. It's okay. I always say, don't assume that they may have gotten this already. Sometimes we need to see it 2 or 3 times. So if you get it for the second or third time and you've already filled it out, forward it along to some other brothers, even if you have to forward to the same group of people, just as a reminder to say this is important. If you haven't taken the time, take the time. It only takes about 5 minutes to complete. So that's key. Also looking for the various outlets. We don't have an active web link, but I know Dr. Hayes, you mentioned that you would help to disseminate on some of your outlets. We're exploring opportunities to get the survey out more broadly within different organizations. So just be on the lookout for it. And if you see it, recognize it, complete it, and forward it along.
Well, here's the link again right here. And you saw it earlier. If you didn't see it, rewind, go back, rewind, and see the link. We'll also have a copy of the link down in the narrative for this episode. But don't just look at it. Look at it, click on it, and participate, and then share it, right? Sharing is caring. And this is, if you care about the profession from a workforce point of view, and also to help to bring in and recruit other dentists as an option for a healthcare option, because there are many individuals that still don't even know that dentistry is a career, a potential career for them, right? So all of those types of outlets and being able to disseminate to those points are important. That's why it's important to share. We put it in our group and it actually came back 3 times. I think we've got at least 4 or 5 people that have reshared it, right? Because you never know when people are looking at their emails. You never know when people are looking at certain things on social media as well, right? So Absolutely. It's important to be able to continue to share it until the link doesn't work. Until the link doesn't work. So Doc, what's the best way for people to contact you and student Dr. Ashford as well if they have any other questions or want to continue to help disseminate the survey?
Absolutely. I'm at psmith26@uic.edu. And so if you send me an email, I will most certainly see it, I will read it, and I will respond. So again, I think I value this work. I think it's very important. And I'm excited about the opportunity for brothers to be able to use their voices. A lot of times people don't even ask us our opinion. They don't ask us what we think. They're not interested in hearing about what we may have gone through, the good and the bad. Right. So I see this as an opportunity for brothers to be seen, for brothers to be heard, and to pass that knowledge on to these institutions that may or may not have valued it in the past, and may or may not have even thought to engage us and include us in the conversation on how to address this issue.
Well, they will now, because addressing this issue is mandatory. It's mandatory for all schools, right? It's a curriculum requirement related to diversity, equity, and inclusion. And it includes student affairs, it includes recruitment, retention. It's all part of the same thing. So go to the link right now. Go to the link right now. Go to that link right now. All right, and participate. Thanks for your time, Doc. And we're gonna help. Go to the link. Go to the link right now. Go.